All right. Happy Monday, everybody. I am super excited to share some new data that we just got in. It's for a health plan that we're working with, and we're engaging their Medicare Advantage members who have MSK conditions and treating them with our Protera Health solution, which is a virtual multidisciplinary 3-month program designed to be really an integrated practice unit for folks who've got back and joint pain. So we're going to share some of the data we just found. And as I was reviewing the data, I wanted to do a stress test to see how this compares to similarly treated patients in a brick and mortar traditional healthcare setup. I think I found something that was pretty reasonable. So I found a study that looked at patients with back pain who were treated in a multidisciplinary clinic out in San Francisco. And they actually looked at the same PROMIS scores that we did, and they reported them. And so it'd be cool to show a side-by-side comparison. So let's dive into the study that we are comparing our Protera outcomes to. If you're enjoying this content and want to keep getting more education and information about exclusive events that we're putting on at Protera Health, please subscribe to our newsletter, and the link is in the comments below. So this study looked at patients with back pain and looking at the response to a multidisciplinary intervention. A couple things to note. This study had about 241 patients, so it's a little more than the data I'm going to show you from the Protera side. They looked at PROMIS 10 scores, and they looked at both the mental health component and the physical health component. At Protera, we do a number of other measures, including pain interference, anxiety, depression, and so forth. But this is a good point to go from. So what we're going to do is look at what they found. And as I mentioned, this is a multidisciplinary clinic that this university is using. One thing I want to point out is the starting point for these patients when they started the program. So if you look at the PROMIS mental health score, you'll see the patient started with an average score of 44.8. Anything 45 and higher is about normal. And with mental health scores, the more you have, the better. So they're starting at 44.8. With the physical health score, they're starting at about 39.4. Again, 45 and higher is considered normal. So if we look at our study here, our physical health score that started off was a 40.3, which again, if we compare to their physical health score, is pretty close. It's about 39.4. So really close, similar population. Mental health score started at 44.8. Ours started much higher at 47.2. So a little bit different there. So let's take a look and see what the score changes were as a result of that multidisciplinary program. And what we see is the study authors for this study showed that the change in the PROMIS mental health scores was about 0.86. That's a little bit less than 1 point improvement. When we look at the mental health score changes from the Protera group, we see a little bit stronger response at 2.8 points improvement. About 2.5 points is considered clinically meaningful. So the virtual multidisciplinary program with Protera was able to actually have a pretty significant and clinically meaningful improvement in mental health. Now, let's look at physical health. So if you look at the physical health score change in the population that had the in-person multidisciplinary care, what it showed was that there was an overall improvement of about 2.4 points, which is approaching clinically meaningful change. When you look at Protera, what you're seeing is the improvement average of 4.6, so pretty drastic improvement in that score. So again, not fully apples to apples, but at least in the type of patient and the measurement, pretty close. So I think what take home for me is that the virtual program, if you do it right, you can get the same changes you'll get from an in-person program, probably a lot more affordable for the health plan, and even more substantial of a change. Now, other measures that we looked at pain interference. This is another PROMIS score, a 4.8 improvement. Again, these are surgical grade improvements that we're seeing in a digital health program. Mental health scores, a PHQ-2, which is a depression screen, that's a 43% improvement with the Protera program. A GAD-2 is anxiety, and a 33% improvement from the Protera program. Again, those are screens, so you have to keep that in mind, but really significant improvements. And nonetheless, when you look at satisfaction with the program, 9.4 out of 10, and a net promoter score of 81, which is really, really strong. Our Medicare members are using the program or having appointments with us 3 times a week or more over the course of a 12-week program, and they're watching nearly 20 educational videos. If you are a health plan and you want to see similar improvements in pain, function, mental health, and engagement in your members, send me a message. Happy to talk more. And otherwise, I hope you guys have a great day.